Hi everyone, welcome into another Anatomy and Physiology live stream. Happy Saturday. I hope you all are having a great weekend. Welcome in as you join into the live stream. Hello everybody, hello. I'm Ollie, it's nice to meet you. We're going to be going over some Anatomy and Physiology practice questions today. What we're going to do, we have some ANP2 questions on some blood vessels, the urinary system, and skeletal and muscular system for both ANP2 and ANP1. We'll start off with ANP2. Move over to ANP1. How's everyone doing? I hope you all are doing very well. Thanks for joining the live stream this weekend. I hope you all are doing super well. But welcome to Ollie's Anatomy and Physiology live stream for Anatomy and Physiology. How's everyone doing? Hello. Happy Saturday. Feel free to say hello. How's everyone doing? Thank you guys for liking the live as well. The more that you guys do like the live, the more that it'll get it out to people. If we can help as many people as possible. Hey, Chica Red, how you doing? Good to see you again from yesterday. Hey, Jay Renee, how you doing? How's everyone doing today? Awesome. We'll get started here in just a moment. But anyway, welcome to the live stream. Welcome to Ollie's Anatomy and Physiology Practice Review live stream, where we are going to make Anatomy and Physiology finally make sense for you all. We're going to go over some ANP2 stuff today, and then we're going to move over to some ANP1 stuff today as well. Hey, Rose Baby, how you doing? Happy Saturday, everybody. Hello. Welcome in, everyone. But again, everything that I'm going over today can be found on my website. All my notes on Anatomy and Physiology are on my website. That is linked in my TikTok bio. We will go ahead and get started here with the questions now, everybody. Welcome in. I'm Ollie. It's nice to meet you all. I'm just going to set my questions down here and flip the camera around, and then I will show my face a little bit later in the live again as well. All right, can everybody see the questions? Can everyone see the questions? And then I'll go ahead and get started. Just a simple yes or a thumbs up or something would be great, just to make sure you guys can see these questions. Thanks for the follows as well. Yes, perfect. Number one, so I have some questions on blood vessels here. Number one, which factor has the greatest influence on resistance in blood vessels? A, B, C, or D? If you're new here, what you do in the live stream is I ask a question. I have answer choices here, A, B, C, and D. Whatever you think the answer choice is, you just go ahead and put that down in the comments. And then we will say what the answer is, and then I will give an explanation for why the answers are right and why the answers are wrong. But welcome, I'll give you guys just a moment to answer, but we're almost at 1,000 likes already on the live stream. I just flipped the camera on. That's insane. Thank you guys so much. I appreciate it. The more that you guys do like the live and share the live, the more that we can help as many people as possible in anatomy and physiology. But as you're just joining, everyone that's joining, welcome. My name is Ollie. Welcome to my Anatomy and Physiology Practice Review live stream. We are going to make Anatomy and Physiology finally make sense for you. We're going over both ANP2 to start off, and then we're going to move on to some ANP1. But Number one, the answer, which factor has the greatest influence on resistance in blood vessels? The answer is B. It is the vessel diameter. So resistance is going to be most sensitive to vessel diameter due to this law, where resistance is inversely proportional to the fourth power of the radius. So very small changes in diameter have very large effects. All the other ones do matter, but they are not the greatest of influence here. Viscosity is it's relatively constant. Vessel length would influence resistance, but it doesn't change very quickly. And then blood pressure is a force, not exactly a determinant of resistance. So it's going to be vessel diameter. Number two, blood flow is directly proportional to which the following? A, B, C, or D? A, B, C, or D? You're going to see a lot of these questions on blood vessel physiology on your exams for anatomy and physiology. We're at 1.3 thousand likes already, guys. That's insane. When am I doing my pharmacology live? Probably next week sometime. I'll get back to you. I got to schedule that in to make the exam. But it'll probably be next week. It will definitely be next week. Just not sure what day yet. Thank you guys so much for the gifts. Gretzky, thank you so much. Thank you guys for 1.6 thousand likes already. Thanks for the follows as well. Welcome in. We're on number two now. Number two. What do we think it is? Number two. The answer is C. It is the pressure difference. Which is the change in P. So, according to this formula, blood flow is going to increase when pressure difference, which is our P here, increases as well. Resistance is inversely proportional. Osmotic pressure affects fluid movement, not overall blood flow. Capillary exchange is what happens as a result of blood flow. It's not a factor in determining that. Number 3, what is the correct formula in describing the relationship between blood flow, pressure, and resistance? What is the correct formula? I have an exam on next week on Friday, so please do earlier. Yeah, so yes, send me a message again. Let me see what's on your pharmacology exam, or send me an email. But hit the orange button. Let me know what's on that pharm exam. I'll put some questions on there. And anyone else who has any topics on their exams coming up, just please send some requests via the orange plus button down there. Alrighty, number 3, the correct formula is B. It's B. This is the derived from the Ohm's law for fluids. Number 4, which nervous system division increases heart rate and causes vasoconstriction? A, B, C, or D? Which nervous system will increase heart rate and cause vasoconstriction? A, B, C, or D? How many questions I do? Today I have 50. I normally do anywhere between like 30 and like 100, but today I have 50 questions. We're almost at 3,000 likes on the live stream already, guys. That is insane. Thank you guys so much. You guys are crushing it. Number 4, the answer is D. It is the sympathetic. Sympathetic, remember that it is our fight or flight response. Parasympathetic would slow down your heart rate, right? And then these aren't exactly relevant. Number 5, which of the following decreases blood pressure? Which of the following would decrease blood pressure in blood vessels? A, B, C, or D? You got a big test on Monday. Good luck on your test. If we could get a good luck in the chat, that'd be incredible. What topics are today? So I have A&P 2 topics today and A&P 1. For the A&P 2 topics, we have some cardiovascular system stuff with blood vessels, and then we also have some urinary system questions, and then we have, for A&P 1, we have the skeletal system, and we have the muscular system today. I'm in med school, still appreciate this. Awesome! Yeah, no, this will be great review for you as well. These are more focused on your undergraduate anatomy and physiology course, but these will help you with some of the more review questions as well. Number 5, which of the following decreases blood pressure? The answer is C. It's our A&P. It's our A&P. A&P is going to promote sodium excretion and vasodilation, which will inherently lower your blood pressure. Epinephrine, angiotensin II, and norepinephrine are going to basically increase blood pressure by vasoconstriction. So you increase blood pressure with vasoconstriction, or you can increase cardiac output. Alrighty. Number 6, moving on to the next question. Where are baroreceptors that regulate short-term blood pressure located? Where are the baroreceptors that regulate short-term blood pressure located? A, B, C, or D? What do you think? Where can you get these practice questions? So I have a little community here on TikTok that you can join, and here I'm going to pin it here. Once you join that, just send me you just hit that little button that I put up there, our exclusive community. You just join our community, send me your email, and then you will get, pretty much at the end of the week, you will get the PDFs to all the lives I went over that week. I'm sending them out tomorrow morning. Number 6, where are they located? The answer is going to be A. It is the carotid sinus and the aortic arch. These locations sense the stretch due to the pressure basically coming from our heart that we pump out that sends the feedback to our medulla. Right? The other ones are not locations. I'm going to move on to the next page. And remember, you can watch the replay on YouTube as well. Number 7, which hormone increases blood pressure by promoting water retention? And if you are just joining, welcome to Ollie's Anatomy and Physiology Practice Review live stream, where we are going to finally make A and P make sense together. Again, everything that I'm going over are in my anatomy and physiology notes. You can find them in my TikTok bio, and you can find the replay. Every single replay will be on YouTube. That is also linked in my TikTok bio. But number 7, which hormone increases blood pressure by promoting water retention? That is B. This is a little bit of an endocrine system question as well. Remember that the hormone that will increase blood pressure by promoting water retention is antidiuretic hormone in the kidneys. Specifically, how it does so is by raising your blood volume and pressure. All right. Number 8, long-term regulation of blood pressure is primarily controlled by what? So when we're talking about regulating our blood pressure in the long term, what is that going to be done by? A, B, C, or D? So there's short-term versus long-term here. What do we think it is? Do I ever practice for the TEAS test? Yes, I do. I normally do. Yes, we'll be going over that again Monday and Tuesday for the HESI and TEAS for anatomy and physiology. Aldosterone is going to increase blood pressure through promoting sodium retention. Water always follows sodium. Thank you for 5,000 likes on the live stream already, guys. That's absolutely fantastic. Thank you guys so much. That is awesome. No, you guys are absolutely crushing the like button. That is incredible. Thank you guys so much. Number 8, the answer is B. It is the kidneys. This is our long-term regulation. They regulate our blood volume, which is our major determinant of long-term blood pressure. A and C, our sympathetic nervous system, and our baroreceptors, like we just went over, these are going to be short-term. And capillary exchange is local, so it wouldn't be systemic. Number 9, which of the following would most likely increase vascular resistance? A, B, C, or D? Put your answer choice down in the comments. If you are new here, thanks for following. But if you are new here, thank you for the gift. QA Train, thank you so much for the gifts. I really appreciate it. It means the world. That's absolutely fantastic. Any support in doing these live streams means the absolute world to me. You're providing great content. Thank you so much. I try. Thank you for being here. Thank you for being a great audience and community, honestly. But thank you guys so much for being here. As someone who doesn't take them, I guess C. For number 9, if you guess C, you're absolutely correct. It's vasoconstriction. It's vasoconstriction. So which of the following would most likely increase vascular resistance? It is going to be vasoconstriction. Why is that? When you vasoconstriction, pretend the hole in my hand here is going to be our vessel. If we constrict that, you're decreasing the diameter, so a smaller diameter would mean higher resistance. Number 10, which hormone is part of the RAAS and directly causes vasoconstriction? And remember, this is our renin angiotensin aldosterone system. If you don't know what RAAS stands for, very big in the urinary system and blood pressure and blood vessels and whatnot. The majority of you are putting C, it looks like. And if you put C, you're absolutely correct. Angiotensin 2. Angiotensin 2. It is a very, very important vasoconstrictor in the RAAS pathway. Again, ADH is going to retain water. It would be a weak vasoconstrictor. ANP opposes angiotensin 2, and then insulin is not involved here. Number 11, which force primarily pushes fluid out of capillaries during exchange? A, B, C, or D? Whatever you think the answer is, put it down in the comments. A, B, C, or D? I saw there was a question. If I missed a question, feel free to repeat it in the comments. This is a great review for ICU RNs. Awesome. Yes, no, that's perfect. Monday, while I go over TEAS practice, yes. Yes, so sodium encourages water retention because water always follows sodium. So particularly aldosterone will promote sodium retention directly, indirectly promoting water retention because water follows sodium. But antidiuretic hormone promotes water retention directly. That's the difference between antidiuretic hormone and aldosterone. I try to go over that quite frequently in live streams because I know a lot of students get those mixed up. But real quick, moving on to number 11 now. Number 11 is B. It's hydrostatic pressure. Hydrostatic pressure. It is the blood pressure that pushes fluid out of capillaries into tissue. Osmotic pressure and oncotic pressure, these are going to pull fluid into the vessels. Filtration pressure is the net results of hydrostatic and osmosis forces. It's not a driving force alone, it is the result of the forces. Okay? So again, these two pull in vessels. Should I put into vessels? All right, number 12. What causes fluid to enter the capillaries from the interstitial space? A, B, C, or D? What do we think it is, guys? A, B, C, or D? Thanks for the follows. Welcome into the live stream. So happy that you're here. We're almost at 10,000 likes already. This is insane, guys. I'm actually not going to be going live tomorrow, mainly because I'm celebrating my family tomorrow for some things. But I will be live again on Monday at 3 p.m. Eastern Standard Time. I'm actually going to post a schedule for next week on my TikTok, so stay tuned for that. I'll also put it on my website as well, hopefully. But I'll post a video and I'll have my schedule for the live stream. But Monday, we'll be going over HESI and TEAS for ANP1. Number 12, what causes fluid to enter the capillaries? Thank you guys for following. What am I writing on? 12.9-inch, second generation iPad with the second generation pen. It's linked in my recommendations on my website, linked in my TikTok bio if you want the exact one. Number 12, it is B. It is plasma protein-driven osmotic pressure. All right, so albumin and other proteins create the oncotic pressure that will pull water in, right? A and C would cause fluid to exit our capillaries. Okay? All right, we're going to move on to the next page here, everybody. We're going to move on to the next page. Number 13, what is the equation for net filtration pressure, NFP? And I'll look at some questions here. If I miss any questions, please feel free to repeat them. Sometimes I write on my screen and I do miss questions. But thank you all for the follows. Thank you all so much for being here. Awesome. So if I miss any questions, please. Thanks for what I do. Thank you, Ronald. Thanks for being here. Yep, repeat that, please. And again, you can watch on YouTube again as well. But for number 12, plasma protein-driven osmotic pressure is the answer that causes fluid to enter capillaries from the interstitial space. Albumin and proteins create oncotic pressure that pulls water in. And then when A and C, our increased hydrostatic pressure and capillary dilation are going to cause fluid to exit the capillaries. So leave. Number 13, the answer is C. The answer is C. This reflects the balance of pushing hydrostatic forces and then pulling osmotic forces. Number 14, moving on to the next question here. Number 14, what effect does stimulation of the parasympathetic nervous system have on the heart? A, B, C, or D? And welcome, if you're new to the live stream, hello, it's nice to meet you. I'm Ollie. Welcome to Ollie's Anatomy and Physiology Practice Review live streams, where we are going to finally make anatomy and physiology make sense for you. I am here to help you pass your summer A&P exams. I'm pretty much going to go live every day. I'm not going to go live tomorrow, but I'll be live every day next week. Thank you for the Rose QA Train inspiration. Thank you so much. Thank you guys so much for being here. I appreciate the gifts and I appreciate the likes on live. We're almost at 11,000 likes already, and there's over 400 of you in here already. That is insane. Thank you, Dr. Trey. Thank you so much. Oh my gosh, thank you for the Galaxy. Thank you so much. I do teach other ones as well. Do I do 2 YouTube videos? Yes, I do. I actually have a playlist on there that I go over different things, but I post every replay to the live stream on YouTube as well. It's linked in my TikTok bio. And then I also post other different types of YouTube videos outside of the replays. And then I do post TikTok videos about A&P. We also do cover other topics. We do biochemistry, pharmacology, microbiology, typically any sort of like medical education topic we will do. But number 14, let me give you guys the answer to that one now. What effect does stimulation of the parasympathetic nervous system have on the heart? The answer choice is going to be A. It is going to decrease heart rate. Remember that parasympathetic. Again, in Spanish, para means stop. But the way that I always think of it is parachute. Parachute slows you down from falling. It's going to slow down your heart rate. Specifically, it is going to act on the vagus nerve, and it'll slow down heart rate. Alrighty, all the other ones here are sympathetic effects. Number 15, which system is directly involved in long-term blood pressure control by regulating blood volume? A, B, C, or D? What do we think that one is? A, B, C, or D? I need this to go into radiology. Yes, you do. You definitely need anatomy and physiology for radiology. There's a lot of radiology students in the live streams as well. Oh my gosh, your vagus nerve doesn't work. That's not good. That's not good. I'm only taking anatomy this summer. Hopefully your anatomy and physiology this summer is going well. Is anatomy always with physio? Not always. A lot of schools will do A and P together, or they'll do them separate. I think personally, it's better when they're together because structure always relates to function. It just makes a little more sense, in my opinion, to teach things together. But, you know. Number 15, the answer is C. It is the renal system. It is the renal system. The kidneys regulate blood volume via fluid output. So your urination, essentially. Number 16, what is the primary function of the kidneys? A, B, C, or D? What is the primary function of the kidneys? A, B, C, or D? There's a lot of, with the cardiovascular system and the renal system, they really work together a lot. So that's why it's really important to know the correlation between the renal system and the cardiovascular system. We're at 12.5 thousand likes, guys. That is absolutely insane. Thank you guys so much. That is awesome. There's a lot of veterinarian students that do join these live streams, but this is particularly human anatomy and physiology. Number 16, the answer is A. It is going to filter blood and produce urine, right? So we're removing waste and regulating the fluid and electrolyte balance in our system. Number 17, which part of the nephron is responsible for filtration? Which part of the nephron is responsible for filtration? A, B, C, or D? If you're new to the live streams here, all you have to do is put whatever you think the answer choice is down in the comments, A, B, C, or D, and then we'll take a look. We'll see if it's right or wrong, and we'll explain why it's right and why it's wrong if the answer choices. We'll explain the right answer a little better. But number 17, the answer is C, is the glomerulus. The glomerulus is the main structure here. It's the capillary network that is going to filter the blood into the nephron. All the other structures here, the loop of Henle, DCT, and collecting duct, that's more so for reabsorption or secretion, or obviously collecting with the urine. But number 18, which structure receives the filtrate directly from the glomerular capsule? So once it gets filtered, where does it go? What's the next step here? What structure receives the filtrate directly from the glomerular capsule? A, B, C, or D? What do we think it is? A, B, C, or D? We're almost at 14,000 likes already. Awesome. The answer is going to be C. It is our PCT, our proximal convoluted tubule. This is the first tubular segment after filtration. A, B, and D all come after the PCT. Moving on to the next page. Moving on to the next page now, guys. Number 19, what process moves substances from the blood into the renal tubule to become part of the filtrate? What process would that be called? A, B, C, or D? Think of let's say when we're the active movement from blood into the tubule. What is that? What is that? A, B, C, or D? Perfect. A lot of you are putting A. You're absolutely correct. It is secretion. Secretion is going on here. Again, secretion is the active movement from blood into the tubule. Filtration would occur at the glomerulus, like we mentioned. Reabsorption moves substances back into the blood. Osmosis is just passive water movement, right? Number 20. Which hormone increases water reabsorption in the kidneys? Again, asking this question. We kind of went over this a little bit ago. But again, I try to ask this question pretty frequently. A, B, C, or D? Dang, where were you when I had to take this class? Oh, no. Sorry I wasn't here when you were taking the class. We're almost at 15,000 likes. Retake, I said, over my dead body. Yeah, I don't blame you. I definitely don't blame you. Number 20. The answer is C. It's the antidiuretic hormone. Again, a lot of students get it mixed up between aldosterone and antidiuretic hormone. Antidiuretic hormone promotes water reabsorption directly. Aldosterone will do it indirectly because it promotes sodium retention, and then water follows sodium, right? So indirect water retention there. Number 21, which part of the nephron creates a concentration gradient in the medulla to concentrate urine? A, B, C, or D? Also, if you're just joining the live stream and you are new here, hello, it's nice to meet you. I'm Ollie. Welcome to Ollie's Anatomy and Physiology Practice Review live stream. I'm here to make anatomy and physiology finally make sense for you. I want to help you pass your classes. I want to help you pass all your exams that have A&P on it, like the HESI and TEAS, DAT, MCAT, your EMT stuff, pretty much like whatever. This is fantastic review for people who have taken anatomy in the past and don't remember things. It can help you connect the dots a little bit here as well. Number 21. We're moving on to the next question now. If you're following along, we're on number 21. Which part of the nephron creates the concentration gradient in the medulla to concentrate the urine? That is C. That is the loop of Henle. Especially the descending and ascending limbs. They're going to generate that medullary osmotic gradient. Number 22, aldosterone promotes the reabsorption of which ion? I just covered that. Hopefully you were paying attention. Let me see if you were paying attention. So number 22, aldosterone promotes the reabsorption of which ion? A, B, C, or D? Fantastic. I'm seeing sodium. You're absolutely correct. Remember, it'll promote the reabsorption of sodium, and then water follows. So indirectly promoting the reabsorption of water as well. Number 23, what structure carries urine from the kidney to the bladder? So when we go from the kidney to the bladder, and then we have a structure that goes from the bladder to the external environment. So let's draw that. So we have our kidneys. Let's just say this is our bladder, and then that's the structure from the external environment. That's just basically the simple way to draw out that structure. Perfect. It is B. You guys are absolutely correct on that one. It's the ureter. The ureter are these two structures here. These are your kidneys. This is your bladder, and then the urethra would be here. Hopefully you are urinating into a toilet. But number 24, what is the correct order of filtrate flow through the nephron? Thank you, Lara, for the rose. Thank you guys so much for the gifts. You guys are absolutely incredible. Thank you all so much. You guys are absolutely incredible. I really appreciate the gifts, guys. They mean the absolute world to me. I love doing these live streams, so any support in doing them means the absolute world to me. Number 24, what is the correct order of filtrate flow through the nephron? We're at almost at 17,000 likes already. That is absolutely insane. There's almost like 500 of you in here as well. Welcome to the live stream, everybody. We're at 17,000 now. That is insane. That is insane. Thank you guys so much. Number 24, the answer is A. So again, let's follow. We'll go through this a little bit slower just so we can make sure we get this across on the correct order of filtrate flow. Here is the pathway. It's A. We go from the glomerular capsule to the PCT, then to the loop of Henle, to the DCT, and then into the collecting duct. That is the correct anatomical sequence. The other answer choice is just mix up that order there. All right, we're going to move on to the next set of questions here. I'm also going to take a look. I see some questions in there. I'll take a look here once I read this question. Number 25, which force drives glomerular filtration? A, B, C, or D? What days and times am I live? Pretty much I go live every day. I'm not going live tomorrow, mainly because I'm with my family tomorrow. But I'll be live next time on Monday at 3 p.m. Eastern Standard Time. I'll be live every day next week, though. I'll be posting a schedule tomorrow night on TikTok. You can go look at the post. Hopefully you can save that, and then you can take a look when I'll be live. Also, my profile on TikTok, in the bottom corner, or like the bottom of my bio, will say like next live event, and it'll say when it's scheduled. Number 25, the answer is A. It is blood hydrostatic pressure. The pressure in the glomerular capillaries push fluid into the capsule, right? Okay. Number 26, which of the following is normally not found in urine? Which of the following is normally not found in urine? And if you're just joining us, welcome into the live stream. Hello, hello. If you have any, I do go over anatomy and physiology pretty much every single day. I take topic requests via the orange button there in the bottom left corner. Or if I just missed something and you need a deeper explanation on something, I'd be happy to make a video on it. Just let me know via that orange button in the bottom left corner. Everything that I am going over today as well is on my anatomy and physiology notes. Those are linked in my TikTok bio. Number 26. The answer is B. It is glucose. Glucose is normally not found in the urine, so under normal glycemic conditions, all glucose will be absorbed or reabsorbed in the PCT. Basically, it's an indication of some sort of diabetes or some sort of condition. Number 27, which condition would most likely cause an increase in urine output? A, B, C, or D? Thanks for the follows, everybody. Thank you guys so much for following. I always love seeing new faces. Welcome, everybody that just joined. Welcome. My name is Ollie. Welcome to Ollie's Anatomy and Physiology Practice Review live stream. We're going to finally make anatomy and physiology make sense for you. I really just want to create a community in here where we are helping you pass your anatomy and physiology exams, your HESI, your TEAS, your DAT, your MCAT, your radiology, tech exams, just everything like that. I absolutely want to help you guys succeed, and not only just pass your classes, but absolutely just ace them as well. Hi, can I go over the reproductive system? Yes, I do. I normally go over that in AMP2. If there's any topics, please hit the orange button and send me some reproductive system topics. I will make questions. Pretty much every question today is from you guys that you guys have been sending me via that orange button. Number 27, the answer is C. It's decreased ADH. It is decreased antidiuretic hormone. So again, antidiuretic hormone, as we mentioned, we've gone over in this live, it increases water reabsorption directly. Remember, aldosterone was indirectly through sodium reabsorption, but decreasing ADH reduces water reabsorption, which would dilute the urine and creating a higher output. All right. So again, we have a decreased ADH here. This increases the dilution. I shouldn't say increase. Let's just say dilutes urine, leading to an increase in urine output. All right, number 28. Number 28. What is the role of the DCT, the distal convoluted tubule? A, B, C, or D? If you are new here, if you just put your answer to us down in the comments, A, B, C, or D. Chigaritza, thank you for teaching us. Of course, I'm absolutely happy to do this. I absolutely love doing these live streams. We're almost at 20,000 likes already, guys. That is insane. Thank you guys so much for liking the live. The more that you guys do like the live and share the live, the more people we can get this out to and help as many people as possible in anatomy and physiology. And I also do other topics as well. You can request them in the bottom left corner there. And the orange button. Number 28, the answer is B. It is going to fine-tune our salt and water reabsorption. The DCT reabsorbs sodium and calcium under the control of aldosterone and parathyroid hormone. It'll also adjust the pH as well. So it's really involved in our fine-tuning. Number 29, which structure is going to store urine before elimination? A, B, C, or D? What do we think? What stores it before we eliminate urine? A, B, C, or D? Can I share resources for anatomy and physiology? I do share resources, actually. They're on my website. They're linked in my TikTok bio. Every single resource I have for anatomy and physiology is available on my website. And then I also do post videos here on TikTok as well. I do video requests as well. You can message me them or comment them on my TikTok videos. But number 29, the structure that is going to store that is going to be B. It's the urinary bladder. The urinary bladder is that muscular sac, again, of our transitional tissue, if we think back to histology for stretching, that'll temporarily store urine. Number 30. What triggers micturition reflex? What triggers that? A, B, C, or D? A, B, C, or D? What do we think? A, B, C, or D? We're 21,000 likes already. That is insane. This word essentially is our key to go and urinate, essentially. The minimum transit time of a red blood cell across the pulmonary capillary membrane required to facilitate gas exchange. I think it's about a quarter of a second, so 0.25 seconds, I believe. I have to send me a question on that one. I have to double check. I don't have that on me as well. But number 30. The answer is C. It is the stretching of the bladder wall. So we activate our stretch receptors. That is going to happen. It's going to send it up the spine, and then that is going to give us our urge to basically void our urine. All right, moving on to the next page here. Those were all the questions for anatomy and physiology 2. For anatomy, I'm going to move on to some anatomy and physiology 1 questions. We have skeletal and muscular system questions. Number 31, which bone is located in the axial skeleton? These TEAS questions, these are concepts for the TEAS. I did not specifically make these questions in mind with the TEAS. That's going to be Monday and Tuesday. So Monday will be A and P1 for HESI and TEAS, Tuesday A and P2. But these questions are concepts that is tested on the TEAS and the HESI, okay? Read the answers out loud. Yes, okay, I can read some of the answers out loud. Yes, so number 31, which bone is located in the axial skeleton? The answer choice A, vertebra, B, clavicle, C, scapula, or D, humerus. That is going to be A, the vertebrae. So the axial skeleton, remember, this is going to be our skull, our vertebrae, or our spine, our ribs, and our sternum. And then the appendicular skeleton includes all of these. So upper limbs, and then your pelvis. Number 32, the Okerman process is a prominent feature of which bone? The Okerman process is a prominent feature of which bone? A, B, C, or D? A, radius, B, humerus, C, scapula, or D, ulna? And welcome into the live stream for those of you who are just joining. Hello, hello. My name is Ollie. It's nice to meet you. The correct answer aloud. Gotcha. Number 32. The Okerman process is on which bone? The answer is D. It is on the ulna. So the okerman in the posterior elbow tip of the ulna, this is where the insertion is for the triceps brachii, right? So the radius, humerus, and scapula, they have different landmarks, obviously. Number 33, which bone articulates directly with the femur at the knee joint? Again, directly. Which one is directly? A, B, C, or D? Thank you guys so much for following. Welcome into Ollie's Anatomy and Physiology live stream. We go live pretty much every day covering anatomy and physiology. These live streams are reviewed to help anatomy and physiology finally make sense for you. My name is Ollie. I have a master's degree in molecular medicine, and I've been tutoring anatomy and physiology for about 5 years now. We also go over other topics as well. You can request those as well. I was also a pharmacy tech for 4.5 years, so I definitely love doing pharmacology on here as well. Number 33, the answer is B. It is the tibia. It is the tibia. So which bone articulates directly with the femur at the knee joint? It is the tibia. Again, so this is going to form the main hinge of the knee. The fibula, again, is next to the tibia. It does not articulate with the femur. It's just more so there for supporting the lateral aspect of our ankle. The patella is, it glides on the femur. It is indirect. The calcaneus, that's a heel bone, so not involved there. Number 34, the foramen magnum is found in the what? A, B, C, or D? A, B, C, or D? A, occipital bone, B, temporal bone, C, sphenoid bone, or D, parietal bone? A, B, C, or D? I forgot my NP one. Well, this is perfect for you then. It's absolutely perfect. Especially if you're someone who's taken anatomy and physiology before and you don't remember stuff, this is perfect review for you as well. And hello to everybody that just joined. Welcome to Ollie's Anatomy and Physiology Practice Review live stream. This is where anatomy and physiology, I promise, will finally make sense. We're on number 34 now if you're just joining us. Number 34 asks, the foramen magnum is found in the... Answer choice is going to be A here. It is the occipital bone. This is the large opening at the base of your skull. It is located in the occipital bone. This is where your spinal cord exits your cranium, if you did not know. Number 35. Which bone is classified as a flat bone? A, vertebra, B, sternum, C, femur, D, radius. A, B, C, or D. Which of the following is a flat bone? Remember that flat bones they're more broad. They have like a thinner plate. Which one do we think that is? A, B, C, or D? Perfect. If you put sternum, you're absolutely correct. The sternum is a flat bone. It's B. Number 36, acetabellum is a feature of which bones? A, B, C, or D? A, B, C, or D? A, B, C. Perfect. It is A. These are hip or coxal bone. So that is like that deep, like cupish feature on your pelvic bone. That's where your femur is going to fit, forming your hip joint. So if we have, let's have our person here. If we took this out, and it looked like this, and this is the head of your femur. That's essentially what it would be. All right, moving on to the next page now. 37, number 37. We're moving on to the next page. Which of the following is a function of the skeletal system? Which of the following is a function of the skeletal system? A, B, C, or D? A, B, C, or D. We're at 25,000 likes. Thank you guys so much for all the likes in the live stream. That is insane. Thank you all so much. And welcome to everybody that just joined. We're moving on to the next page here now to number 37. Welcome. My name is Ollie. This is the Anatomy and Physiology Practice Review live stream, where we are going to make anatomy and physiology finally make sense for you if you're having trouble with A&P. Also, everything that I'm going over today, I do have anatomy and physiology notes available on my website. This is kind of what they look like. They are available on my website. They're linked in my TikTok bio, but we're on number 37 now. Let me give you the answer to number 37. It's going to be B. Hematopoiesis is a function of the skeletal system. Hematopoiesis is our red blood cell, our white blood cell, and platelet formation. and production that occurs in the bone marrow. Red blood cell specifically is erythropoiesis. Number 38, which type of joint is found between the metacarpals and our phalanges? A, B, C, or D? A, B, C, or D? Thank you guys so much for the follows as well. Also, if you did miss anything or you joined a little bit late, I do post the replay to YouTube afterwards as well. It's linked in my TikTok bio as well. I think 27,000 likes. That is insane, guys. Thank you guys so much. Number 38, the answer is... Oh, I accidentally scrolled all the way up. Is A. It's condylar. It's condylar. So these are... So they're biaxial condylar joints for like flexion and extension and abduction and adduction, right? Saddle joint would be more so at your thumb joint. Pivot is the radius ulna plane or like carpals. Number 39, the deltoid tuberosity is found on which bone? The deltoid tuberosity is found on which bone? A, scapula, B, humerus, C, clavicle, or D, radius. What do you guys think it is? Put your answer choice down in the comments. A, B, C, or D. I have to go to lunch, but I'm loving your page. Have a good lunch. Sweet fake kiss. Thank you for being here. Thanks for joining our live today. Remember, you can also request topics via the orange button in the bottom left corner there. Pretty much every question from today's live stream came from you guys submitting requests. Number 39, the answer is B. It is the humerus. The deltoid tuberosity is found on our humerus. That is the prominent rough area on the lateral aspect of our humerus so that our deltoid muscle can attach. Remember? Number 40, which bony landmark is the point of attachment for the Achilles tendon? For the Achilles tendon. A, B, C, or D? Can we do med terminology? Yes, we can do some medical terminology. A, B, C, or D. We're at 28.5 thousand likes already, guys. That is insane. Almost at 30. Thank you, Mrs. Lake, for the rose. Thank you guys so much for any gifts you guys give during the live stream. Any support in these live streams. Again, they're my favorite part of my day. I look forward to them all the time. But yes, thank you so much for any support in this. I love doing these. I hope this is helping you learn your anatomy and physiology. I absolutely love doing these. But number 40, the answer is C. It's our calcaneus. Again, the Achilles tendons form the gastrocnemius, and the soleus is going to insert on the posterior aspect of the calcaneus. Number 41, the origin of the biceps brachii is the what? A, B, C, or D? Remember, for anatomy and physiology, all of your attachments and your origins, insertions of muscles and bones and landmarks are very important. The best way to go through that is by making an origin, insertion, innervation, action chart. I actually have that in my notes. They're in my muscular system notes, and then all the landmarks I have a study guide for in my skeletal system questions. I have axial and appendicular skeletal system study guides that I used when I was in the class. Number 41, the answer is going to be D. It's going to be the scapula. The origin of the biceps brachii is the scapula. The biceps, again, bi meaning two, has two heads that originate from the supraglenoid and the coracoid process. So the long head at the supraglenoid and the coracoid process at the short head. Number 42, the insertion of the pectoralis major is the what? A, B, C, or D? What is that going to be? A, B, C, or D? We're 30,000 likes. That's insane. 30K. That is nuts. Thank you guys. You guys are absolutely smashing that like button. I appreciate it. That is absolutely fantastic. Alrighty, for number 42, you guys are... I'm seeing the majority for number 42 be C. However, the insertion, remember the insertion, is going to be B. It is going to be the humerus. It's going to be the humerus. Remember, it inserts on the bicipital groove of the humerus. That is what's going to allow it to adduct. The clavicle and the sternum are considered origins. Remember, origin is closer to the point of attachment, so that would be our clavicle and our sternum, and the pectoralis major. The insertion is the humerus. Does that make sense? Because that's how a lot of people putting sternum. So again, so the sternum would be considered an origin. Does that make sense before I move on? Just to make sure. Because I'm pretty sure that's where we got a little confused, just between the origin, insertion, and stuff. Yes? Yes. Okay, perfect. Moving on to the next page of questions here. Number 43, which muscle is primarily responsible for plantar flexion of the foot? A, B, C, or D? A, B, C, or D? So again, which muscle is primarily responsible for plantar flexion of the foot? That is going to be our gastrocnemius, along with the soleus as well. But the muscle that's primarily responsible. The question asks primarily. The gastrocnemius. The soleus does assist there as well. But again, that's going to be for the plantar flexion of our foot. Moving on officially to the full next page. Number 44, the masseter muscle is responsible for what? The mitochondria is the powerhouse of the cell. Wow, I need to stay on this live. Thank you, Anna. I hope you do stay. I hope you are here in future live streams as well. If you're in anatomy and physiology, I go live pretty much every day. I won't be going live tomorrow, but I will be back again on Monday. I'll be live again every day next week. But yes, the mitochondria is the powerhouse of the cell. However, the mitochondria is more than just the powerhouse of the cell. But yeah, I know it's like the classic science saying, "Oh, you're a massage therapist." That's awesome, Anna. Thank you for sharing. Number 44, the masseter muscle is responsible for C. It is jaw elevation. Jaw elevation. Masseter muscle is responsible for elevating our jaw. That is our powerful mastification muscle that elevates our mandible for chewing. When it comes to next flexion, that is our sternocleidomastoid, or SCM. Smiling is the zygomaticus, and swallowing would be your suprahyoids or your glossopharyngeal muscles. Number 45, the rectus abdominis muscle is going to insert at where? Again, remember the difference between our insertions and our origins. OT here, and I love this review. Awesome! Thank you for being here and chilling. Thank you so much. Yeah, this is perfect review. I know I have a lot of people in here who they've taken anatomy and physiology in the past, but they're not like kind of, they definitely need a review. They just say they need a review and stuff. So this is perfect for those of you who are of the following there. I actually get a lot of like pharmacists in here, which is awesome because I used to be a pharmacy tech while I was in college. I was a pharmacy tech for like 4.5 years during undergrad and graduate school. I loved it. I absolutely love learning about pharmacology. It definitely helped a lot, especially. Number 45, the answer is going to be C, is our xiphoid process. So it's going to insert on the xiphoid process because it runs from the pubic symphysis to the xiphoid process and the lower costal cartilages. It's going to enable the trunk flexion. The iliac crest and the pubic symphysis, these are origins. These are origins, and this is not an option. Number 46, which muscle abducts the arm at the shoulder? A, biceps brachii, B, deltoid, C, pectoralis major, or D, latissimus dorsi? A, B, C, or D? Study tips for the Bones lab test. You're like decades ago. Okay, so Rowie, I actually just posted a video on my TikTok. It's not, I didn't just post it, but if you go back a few videos, I have a how I learned every single bone and their landmark in the body. I don't know when your exam is, but that's how I did it in a week, but it would be the same principle. But basically, it's kind of like my rule of, I kept a chart of ones that I was getting right and I was getting wrong. I had my rule of 5, essentially. Basically, I would take 5 terms, learn and label those terms, add 5 more, learn those 5, add them together, do those 10, and then keep adding 5. I'll stick around and answer that at the end of the live stream more in depth, though. But I have a video on that. I have a video on it. Again, I have a video on it. The answer is going to be B. It is our deltoid. Which muscle abducts the arm at the shoulder? That's the deltoid muscle. Number 47, the biceps brachii inserts on the where? Where does the the tricep brachii insert on? A, B, C, or D? A, B, C, or D? The triceps brachii insertion. We're at 33,000 likes. That is insane. Number 47, though, is going to be C, the okernon of the ulna. All 3 heads converge. So our triceps, meaning we have 3 heads, all 3 of them insert on the okernon process. Number 48, the gluteus maximus is primarily responsible for what? A, B, C, or D? I have the hiccups right now. Oh my goodness. I need to somebody needs to scare me or something. I'm gonna take a sip of my water. Erdo says, oh, Hannah's. Yes, exactly. Number 48, the gluteus maximus is C. It is hip extension. So again, it's our strongest hip extensor. It is critical and very important for rising from the seated position, climbing, everything like that. Very strong muscle. Hip adduction is mostly done by the adductors. So hip adduction is done by the adductors. Knee extension by the quads. Dorsiflexion by the tibialis anterior. Alrighty, last two questions here on Saturday's live stream, everybody. Number 49, the sartorius muscle runs from where? A, B, C, or D? Again, I'll be live again on Monday at 3 p.m. Eastern Standard Time. I'll be releasing my schedule for the week tomorrow night for the rest of the week. But I do go live pretty much at least, I go live pretty much every day. But normally it's at least 4 times a week. It's mostly up to 6. I don't really take at least like 1 day off. But sometimes I do go 7 days. How can I find these questions or video to rewatch? Okay, yeah, so the replay's on YouTube. It's linked in my TikTok bio, or I have you can join our exclusive community here on TikTok. I'll pin it here. If you just hit that and you follow the instructions and you join, once you join, you can send me your email, and then you will get the PDF with the blank PDF with the answer key. Like I said, I have the answer key here. Down at the bottom, my YouTube name, though, if you don't go to my TikTok bio, is my name. It's Ollie Herzig on YouTube. Everything should be up later today. Number 49, though, real quick, second to last question here. Number 49, the answer is going to be B. It's the anterior superior iliac spine to our tibia. So it's that, like, it's the seat belt muscle. Remember, that's that long strap muscle. All right, number 50, last question. Which muscle flexes the forearm at the elbow? This muscle is deep to the biceps brachii. These questions are similar to the ones that I had in grad school, where like the questions more so asked like word. You kind of got to know where things are, especially even without looking at a picture. You got to be able to describe the human body, muscles, origins, insertions, points of attachment, and bone marks based on just words. And just subscribe to my YouTube channel. Thank you so much. YouTube messed with me, man. I thought that I was about to get monetized because I thought it was 3,000 hours because it told me like, oh, you're close to getting monetized with 3,000 hours, but it's actually 4,000. So I need like another 1,000 watch hours. But yeah, I was so excited. I was about to get so pumped, but it's okay. I'll also be making more anatomy and physiology videos on YouTube as well. Number 50, the answer is the brachialis. The brachialis, this is the prime flexor of the elbow. It is deep to the biceps, attaching on the humerus and the ulnar tuberosity. Alrighty, everybody. Again, I will be live again tomorrow. I'm sorry, not tomorrow. Monday is A&P 1 for the HESI and TEAS. It'll be at 3 p.m. Eastern Standard Time. I'll be releasing my schedule for next week. I'm going to be live every single day next week. I will be releasing a schedule tomorrow. I'm actually going to flip the camera around and say hello to everybody. Give me one moment. Flip. Hello, everybody. Hi, it's Ollie. Hello. If I look over here to the left here, I do have the comments pulled up. One sec. How could you? Hey, hello, Ollie. I really do appreciate taking anime through as well. How could I? Hi, everybody. Hello, Trinidad. Hello. Thank you for the awesome review. Thank you for being here, Tara. Thank you guys so much for being here. I absolutely love doing these live streams. Hello, this is Ollie. This is the face of the guy that's been yamming you about anatomy and physiology for the past hour or so. But it's nice to meet you all. Hello, please feel free to introduce yourself as well. How can you obtain the PDF format of the questions? Let me go ahead and pin it here. Actually, I don't think it'll let me pin it again just yet. However, if you go to my profile, there's a subscription button. There's a little star. You hit the star. You join our exclusive community. That's our community. I will send you basically once you join that, you send me your email. And then I will send you the PDF document, blank answer key, blank questions, and then the answer key as well. Great job. Thank you, Dr. T. Ray. Thank you guys so much for all the likes today, all the gifts, and your participation. Chicared80 said, thanks again, Ollie. Hello, my name is your name is Leslie. Okay, I'll try to remember that. I try to remember people's name, but Chicared80 Leslie. Okay. Nice to meet you, Leslie. I know I saw your username, but I will try to remember that. I'm pretty good with remembering names. My memory is really good, but I try. Thank you. Hello. Thank you for the gift. Thank you guys so much. You look so young, such a young man. Thank you. Yes, I'm 24. If that helps anything. I just got my master's degree in molecular medicine in November, and I'm working toward getting my PhD as well. Thank you guys so much for being here as well. One second. I saw some question. If I miss a question, please feel free I'll stick around for like another moment or so. Please feel free to repeat the question. One sec. I'm trying to see. If I'm looking over here, it's because I have the comments, so sometimes I look through, but I guess I missed a question. But please feel free to repeat the question. Just a baby. Thank you. Thank you. Thank Afnan for subscribing. Thank you. Send me your email. I will send you the questions. Ollie the Goat says Emma. Hello. Thank you. Robert said thank you for these. They're very helpful for retaining my knowledge over the summer break. Awesome. Where's Elvis today? They're sleeping in bed. They are knocked out cold. Thank you, Geraldine, for the roses. Can I explain? What was it? Can I describe a blood flow through the capillary bed, please? Yeah, so basically, you start off with your arteries, and then you have your arterioles, and then you move through your capillary bed. That's where your exchange occurs. Then you move through your venules, and then into your veins. Well, let me look at the question again. Sorry, Ray. I saw your question. I was trying to make sure I'm answering right. So some of the every time people comment more, it goes away. So I'm just making sure. Look for the capillary. Was that answering the question? But in terms of the capillary exchange zone, like the capillaries, you have your like continuous, your fenestrated, and you're the sinusoidal. My medical student. No, I just got my master's degree in molecular medicine. I specifically was focused on cancer research for urinary bladder cancer, and then non-small lung cell cancer. And then I want to get my PhD, and I'll probably get that in... Okay, thank you, Ray. I know you requested questions, so I think the first 15 questions were from you, and then some other people have been requesting blood vessel physiology. If I did miss anything today, hit that... I think you have my DM, so just DM me. I can try to answer them later on today. Interested in practice tests for the TEAS? Yeah, so I will actually be doing an AMP1 TEAS and HESI review on Monday. Yes, everybody for perfect, awesome. I'm gonna try to get this YouTube video up later today as well, so you can go back. Thank you so much, Abden, for the finger hearts. Thank you so much. We're almost at our goal today. Thank you so much. You guys are absolutely fantastic. Amazing. Congrats and good luck on your PhD. Your anatomy and physiology is so great. Thank you so much. Good luck for you. Yes, I know. I definitely want to get it. I know the funding isn't exactly there right now, so that's why I didn't do one this year. The programs that I applied to, they lost their funding, unfortunately. The name of my YouTube is my name. It's Ollie Herzeg. However, if you go to the link in my TikTok bio, it'll have the link to my YouTube there. I was a Dr. T. Ray. I was a physiology professor before medical school. Oh no, my life is pathology and autopsy is so fun. Yes. I'm sure that being a physiology professor was very fun. I really want to be a professor one day as well. I love teaching anatomy and physiology. I've been an anatomy and physiology tutor for 5 years now, and I absolutely love it. It is so much fun. I can never get over how fun this stuff is. But again, if I look over here, I'm looking at questions and stuff. Enjoy your Sunday. See you on Monday. Yes, Leslie, right? Yeah, I think I got the name right. Thank you for being here. Yes, enjoy my Sunday. Yes, I am celebrating with my family tomorrow, and then Monday I'll be back again going live for you all. I'm in the U.S. Yes, perfect. Okay, I will try. I try to remember people's names, especially if you are a very frequent viewer on the live streams. Or if I make a video for you or something, I really do try to remember. You guys are all very important to me. I couldn't do this without you guys, seriously. I absolutely love doing these live streams and whatnot. Thank you, Lena. Thank you for being here. Thank you, guys. I'll stick around for another moment or so just to answer some quick questions. Cigarette is fine too, no worries. I'll try. No, I try. I should try. I appreciate you being here and stuff, so I will try. There's a lot of you in here. Thank you, Becky. Thank you so much for being here. No, I promise to try. But thank you guys so much again for being here. Hello again. If you are just joining here anew, this is the end of the live stream. I'll be live again on Monday, 3 p.m. Eastern Standard Time. But these are Ollie's Anatomy and Physiology practice review live streams. Basically, the goal here is I want to make anatomy and physiology finally make sense for you. Again, let me just pull these up. Refreshing for an RN. Yes, this is fantastic review. If you've taken anatomy and physiology before, but you just need a little bit of a review. But I do have all of my anatomy and physiology notes. They're on my website. That's linked in my TikTok bio. I took anatomy and physiology in undergrad and graduate school. It's a collection of all of those notes. Again, I got an A in the class. Sorry, my little thing's in the way. I didn't realize. Thank you for the hand art. Thank you, whoever sent that. Geraldine, thank you for the hand art. Good to see you. I hope. Thanks for joining again. Thank you, Jennifer, for the subscription. Send me your email, please. Send me a DM with your email, or my email is in my TikTok bio. Send me an email as well, and then you will get a PDF of the practice test from today and all future ones as well. It's the blank PDF, and then it has the answer key at the end. I pretty much will be sending those out either by the end of the night or tomorrow morning. Just because I gotta respond. I saw a lot of you sent me DMs and stuff, and I try to respond to everybody. If I haven't gotten to you yet, it's just because there are hundreds, and I'm trying to answer everybody. So just be patient. I promise I'm not like trying to ignore you or anything. Thank you all so much for being here. Again, I'll be live again on Monday at 3 p.m. Eastern Standard Time. Thank you all so much for being here. I really appreciate you guys. I love doing these. I thank you guys so much. I feel like a broken record sometimes, but I love these live streams. I hope they're helping. I get messages every day that people are passing their exams watching this. It's crazy to me. It makes my day. It's just so inspiring to hear from you all and learn about, learn about you guys in general, like what your career goals are, what your goals are in general. And also, just hear about your successes as well. I love being live and someone commenting that they passed their HESI or TEAS or passed their A&P exam. It truly makes my day, and I absolutely love it. But thank you guys. We hit our live goal today on gifts, which is insane. So seriously, like any gifts and subscriptions and anything just means the absolute world to me. These are my favorite part of my day. What's my lab schedule? I'm going to be posting that tomorrow night for next week. I want to get the collection of my tutoring times and whatnot, and I will give the schedule tomorrow night. But the next live, I will not be live tomorrow. I pretty much go live almost every day, but I will be live again Monday, 3 p.m. Eastern Standard Time. Also, if you go to my profile, it'll go to my profile. In like the bottom of my bio, it'll say like live event scheduled, and it'll say the next time that I'll be live. And then I also found out that people put on notifications for the live stream, which is insane to me that people have a notification when I go live. To me, that is like insane to me. But I think that's in the top right corner if you go to my profile, and you can set it to send you a message when I go live. But seriously, thank you guys. I am gonna get going. I'm traveling for a little bit, but I have a train to catch in a few hours, and then I think this thing. So I will see you all on Monday, or hopefully in a future live stream. Once again, thank you all so much for joining. I will hopefully see you again, like I said, on Monday or in a future live stream. Thanks for joining anatomy. Thanks for joining Ollie's Anatomy and Physiology Practice Review live stream, where anatomy and physiology will finally make sense. Thanks for watching. Have a great rest of your weekend, everyone. Thank you guys. Love you guys. Have a great weekend.